Hey everybody, welcome back to Early Morning Barking, talking about BPD and NPD by somebody that has both. Please don't forget to like and subscribe, and there's all the socially things scrolling past where you can follow me and do things there too. So today I want to talk about therapy, because I think that it's something that a lot of people benefit from, and there are a lot of maybe misconceptions, but beliefs that it might not be of benefit. Okay, so first of all, I need to start by making something very clear. Again, if you don't know this, I am in no way any form of medical professional. I am not a therapist. I am just somebody who has these things. I don't have any special knowledge, and I can't tell you that something is the best form of treatment for whatever you're suffering from. So don't take this as medical advice or anything like that. I can simply tell you what experiences I had and how it benefited me. Okay, so I knew I had something wrong with me, and I knew I had problems that needed sorting. I spent years of my life on antidepressants that I didn't need and that did nothing to me because I was never depressed. And if I was, it was purely coincidence at the time, given that most people actually do suffer from depression at some point in their lives. I went through a long period trying to get any form of help beyond that of, oh, you're depressed, here are some antidepressants, which is a very common. I was fobbed off with that for years and years. My entire adult life, in fact, from being sort of 18 to being 40-ish. And then I was fortunate enough to eventually get the process moving. And initially it was thought that I would benefit from doing a course of DBT. And I went through a number of consultations before that was decided. Before it was ever decided what was actually wrong with me, it was thought that DBT was an obvious route out of this. But this process of assessment went on for quite some time, and I can't remember how long a period of time it was over. It was at least months, right? This was not a quick process. And eventually I got put in front of the right people who were able to say, we're going to start running a group. We think you would benefit from it. Would you like to do group therapy? Okay. Now, I was just massively resistant to this at first. I didn't want to go, didn't want to do it, wasn't interested. Which was odd, because I've done lots of therapy before. And maybe that was actually what made it not so odd. Maybe the fact that I'd done lots of therapy and was still looking for help was a big off-putting factor in joining group. And also, I'd spent so long being told I needed DBT that now I'm suddenly being told, no, what you actually need is this. That was quite a jarring experience. But I went through a number of consultations based on that, like with them sort of trying to help me figure out where the group would actually be of benefit, until I eventually decided, what have I got to lose? Give it a go. Now, for me, that turned out to be absolutely life-changing. That turned out to be one of the best decisions I ever made, was to go along with one of the best decisions I ever had made for me, which was that I should go. What I'd done before, all of that old therapy, was never going to help me, because it was all based around a wrong concept. And finally, I'd gotten to a stage where people knew what was wrong with me and I could get the proper help in the right way. Now, for me, the group has been a wonderful thing. Not for everybody, I have to say. There were people at the beginning that are not there now because it wasn't for them. And that's why it's important for me to have said, this isn't for everybody. This is not a magic pill. This is not me saying necessarily that what you need to get over what you have is this group therapy experience. It just worked for me. And I think that while I've been doing it in a group setting, it seems reasonable that were it being done on a one-on-one setting, it would still be a similar sort of process, but it would just play out differently logistically. So why do you need therapy? What's the point, right? Do you need it? Do you need a therapist to tell you what you've got wrong with you, etc.? First of all, actually, yeah. Yeah, you do. You need a therapist to tell you what you've got wrong with you. You can't just treat something if you don't know what it is. And not only that, but you might not have realized everything that's wrong with you. And you might not realize some things that you think are perfectly fine are actually tragically wrong, right? So first of all, yeah, you do need a therapist to tell you what's wrong with you. You absolutely do. Then you can start working on a problem, right? Every problem, you need to know what it is. This is very simple. But then what you need is to start actually working on that problem. And that is mainly what therapy's for. Now, as I said, mine happens in a group setting. Yours might happen individually. But I found that it's been a process of speaking openly and honestly about what I'm going through and what I'm feeling. In a group setting, you share a lot with these people. It's a very... I think you become very close very soon. These are people that mean a great deal to me, and I'm still a bit off kilter that I've not been able to have any contact with them since the beginning of lockdown. Part of group is that there's no contact between us outside of the group. There's an hour and a half a week during which we're a group, and the rest of the time we're not. It's very odd. There are lots of rules in place. There's a very obvious and clear reason behind every rule. For example, the reason why we're not a group out of hours is because, yeah, on the face of it, wouldn't it be great if we had this group of friends that we could get on a WhatsApp or whatever and chat to anytime we feel we have a problem? Yeah, that bit, that idealized view of it is great. What are you going to do when it's 5:30 on a Monday morning and I'm still ringing your phone every 5 minutes, crying and screaming because I'm having a breakdown, but you just need to get your life together and get the kids to school? There's reasons why there are boundaries in this, right? But I digress. I left at the lights to get to where I'm going. You need the therapist to tell you what's wrong with you. You need somebody to challenge your thinking. And in group, that's what we do. And you don't challenge it by saying you're wrong to think that, because that's just being an arsehole. You start off by questioning. Why do you feel like that? Where did that come from? But what evidence have you got? And this comes out as you explain things to people and tell people about events in your life and experiences you've had with your mental health. And it starts to get through the cracks of almost the delusion that we have about how we're doing. When when I get wound up about something, 9 times out of 10, there's no reason to be wound up about it. And so if I can have somebody that will say, why are you wound up about that? Causing me to try and answer that, and not be able to, that immediately diffuses my wound upness. And that stays with you. And these skills of questioning and looking deep into why you feel things stay with you. And these become skills that you learn to cope with things. I don't have any experience of DBT and CBT personally. I tried some CBT a few years ago and didn't get anywhere. That wasn't for me. It may be for you. I can't possibly say. But I found talking therapy to be so therapeutic, to analyze these feelings. If I can encourage you to do anything to help yourself feel better, particularly in stressful down times, when you're in the depths of despair, to start to analyze, why do I feel like this? Because there may not be an answer. And if there's no answer, then you can start to realize that this feeling you've got is effectively false. It's a tricky way to word this thing, because you can't. I'm not trying to say somebody's feelings are wrong. That's not what I'm trying to communicate. What I'm trying to say is that you know these feelings that come with BPD and NPD, particularly sadness, the blanket of sadness that I've talked about. It's not a real feeling. It feels like sadness, but it is to feelings what McDonald's is to food. It looks like it, it smells like it. For a little bit, you can fool yourself into thinking it is it, but it's not. You aren't sad because there's something to be sad about. Look, if you are sad because there's something to be said about, that's a very genuine and valid feeling. And that's not necessarily something you should be rushing to rid yourself of, depending on what is causing this sadness. There's nothing wrong with feeling sad. But if you're someone with BPD that suffers with it in the way I do, then again, 9 times out of 10, that sadness it's a false alarm. It's a fake signal. It's a warning light going off because of faulty electricals, not because of a genuine warning. That's what I mean by it's not a real feeling. And so if I can question it, why am I feeling like this? What am I sad about? And there's never an answer. And it sort of stops. Sometimes. More often than it used to. And sometimes there's an answer. And even then, just like with therapy, it becomes about, well, now I have an answer. Now I have something I can work on, something I can look at, something I can investigate and make go away, a pain I can stop. Because I found it's there. And that's freedom from this. That's the ability to get that blanket off. That's the skill that therapy can give you. That's something you can begin to develop and start to live your life in a more positive way. Now, this process can go on God knows how long. I don't know. Group therapy is slated to last 2 years, now with a massive coronavirus-related break in the middle. Will I be cured by the end of this? Will I be a happy, healthy, normal person? I don't know. But I'm better now than I was a year ago. And I feel the rate at which I'm getting better is accelerating exponentially. And it wouldn't have happened if I were left on my own to feel bad and wonder what was wrong with me, or have decided what was wrong with me and being incorrect about it. Go back and watch NPD in Denial. I'll put a little card up here. It's one of those things where it doesn't hurt to try. Does it? It's therapy. Again, we're not talking about surgery. We're not talking about a drug that might not work. We're not talking about trying to stop taking a drug that does work. We're talking about talking to people. And I'm a firm believer that talking to people about how you feel helps no matter what. So if you can do it in the right setting with the right people, then it can help you so much more. And I can't recommend it enough. A lack of therapy is why I'm doing this. I'm talking to you instead of a group. You're in my group therapy now. This is it. Thank you for taking part. I appreciate it. But the real difference is you can tell people about this. Okay? So if you've been on the fence about therapy, if you have the opportunity to have therapy and you're not sure about it, I recommend it. What have you got to lose? Really? An hour of your life? What's that? Anyway, you take care. I'll see you later. Bye.